It's a sad fact. More than 15 million infants around the world are born prematurely every year. Sadder still, preterm births are the leading cause of global infant mortality. So what's being done to curb this global health challenge? And later, what is the secret to the fountain of youth? I'm Mike Walter in New York City. Let's take it full frame. Preterm births and related health issues accounted for 35% of all infant deaths in 2009. That's more than any other single cause. Now, don't think for a moment this is only a developing world problem, because both the United States and China rank in the top 10 of countries with the greatest number of premature births. That's according to the World Health Organization. But as CCTV contributor Joanne Colan reports, roughly 90% of premature infants die in undeveloped countries versus 10% in developed countries, due in large part to innovative programs that go beyond neonatal care.
The arrival of a new baby can be a stressful time for many families. But as Danielle and Joshua Donahue found out, the birth of a preterm baby takes that anxiety to a new level. Their son Max arrived at just 26 weeks.
Everything was going according to plan, and we were so excited, and I felt wonderful. And then I woke up, it's actually July 3rd, and I knew something was wrong immediately. And we headed over to the hospital a little while later, and I was already in active labor. And they transported me via ambulance to Stony Brook. He was coming quickly. And that's when the panic started, because we just didn't know what to expect.
Not knowing what to expect quickly turned into real fear for Danielle and Joshua.
When we knew for sure that I was going to deliver early, my main concern was, is he going to live? I thought I was going to lose my baby. The NICU team came in and explained to us, his odds and the chances, and they really weren't very good. But I had to remain optimistic and strong for him.
Just that I think that was the overwhelming emotion through those, that first, night and into those, next few days was just that, is he going to be okay, or is his lungs going to develop okay? Is this medicine going to work? Is she, going to hold out long enough, or there's not going to be any long-term damage?
These are the common fears and questions that haunt first-time parents of preemies. And that's why the emotional and educational support provided by the March of Dimes program have a critical impact during the early stages of a preterm baby's life.
I met Lindsay, who is the NICU family support specialist from the March of Dimes. And she provided us with a lot of literature and education and support and emotional support. And it's just someone to talk to who understood what we were going through.
Understanding developed over more than 75 years, in which March of Dimes has worked towards the prevention of polio, birth defects, premature births, and infant mortality. By implementing family-centered care in neonatal intensive care units, or NICU, the March of Dimes programs not only help create that all-important bond between parents and baby, they also save lives. One of the most amazing parts of the March of Dimes program was the implementation of kangaroo care and skin-to-skin holding. And I remember the first time that I held him, they placed him on my chest, and Max was very unstable at that point. And the moment that he was on our chests, his heart rate stabilized, his breathing stabilized, his oxygen saturation stabilized. Everything was perfect, and it was amazing. Kangaroo care really does save lives. March of Dimes programs are implemented all around the world, adapted according to the resources available, meaning parents everywhere can receive the support and education needed during this most critical stage of their baby's life.
Preterm babies are very fragile. Their immune function is very limited. Their central nervous system sort of ability to integrate all the things that we do without even thinking about it, like breathing and eating and keeping our body temperatures normal, are challenges for them.
Sometime later, in a quite poetic turn of events, Danielle would return to the NICU, not as a patient this time, but as a member of staff.
I'm the NICU Family Support Specialist for Stony Brook University Hospital. So I work with NICU families as well as families in the antepartum unit, and those are the moms who are waiting to deliver. And it's inspiring to be there. I love working in a place where miracles happen every day.
A miracle that still eludes millions of babies globally. The Lancet Medical Journal recently reported that for the first time in history, premature birth is the #1 killer of babies and young children, surpassing even infectious disease as the single cause of death among our youngest population worldwide. Back here in the US, at Stony Brook Hospital, first-time parents Joe and Ginny have spent every day in the NICU since their son's birth a month ago. Baby Chase is a preterm birth success story, despite his early fight for survival.
His due date is actually another 3.5 weeks away.
And they're saying hopefully he'll be home by then. So hopefully he'll be home by when he was supposed to be born. So that's our goal.
To bring their healthy baby home and begin a new life as a family, a goal shared by thousands of parents of preterm babies and the March of Dimes, continuing their mission to bring this goal within ever closer reach. For Full Frame, this is Joanne Colan in New York City.